Today our topic of discussion is urinary histology practical.
It has a capsule from the outside. You can see the capsule. There's connective tissue around the kidney and the parenchyma. Capsule of kidney. There's connective tissue surround the kidney. Then the parenchyma of kidney has two parts. In the peripheral area called the cortex and the medulla. Usually with staining, with H&E staining, the cortex is darker than the medulla. So if I go to the medulla, lighter than the outside, the peripheral area. From here, this is the border between the medulla and the cortex. In other things, in the cortex, we can see the corpus.
Renal corpuscles.
You can see the round structure within the cortex. These are
Renal corpus.
marks of the cortex. Okay? See the capsule and detachment of capsule in this area. The convoluted tubule, renal corpuscle, without renal corpuscle. Here is the medulla. Capsular space, glomerulus with the podocyte, mesangial cell, all of these nuclei belong to the endothelial cell of the glomerulus, podocyte, but we cannot recognize which one is the podocyte, which one is the mesangial cell, and which one is the endothelial cell. And the urinary space and visceral, parietal layer, the parietal layer, these cells are parietal layer, visceral layer or podocyte. The proximal convoluted tubule, as you see, they don't have the distinct lumen,
not clearly.
because they are the brush border. But this one is the
DCT.
We can see more nuclei in one section, indicate the cell are smaller than the big PCT. And the part of DCT near the vascular pole, macula densa. Macula densa. Again, the DCT, PCT, macula densa.
Renal corpuscle. Densa.
Three types of ducts. Some of them are very dark, like these. This one. These are the distal convoluted tubule, the straight part of them. But the lighter duct, they are the collecting duct. These are the collecting ducts. And this duct, with a squamous epithelium, these are the loop of Henle. Loop of Henle.
DCT,
a straight part, not convoluted, and a collecting duct. Also this part, the tip of renal pyramid. Renal pyramid and renal papilla also called. So this space is the minor calyx in both sides here and here. And in both sides we have immediately the epithelium, transitional epithelium under the connective tissue. So the connective tissue, urinary epithelium or urocilium, then we have the minor calyces and the tip of renal pyramid. These ducts are the papillary duct or the end of collecting duct. Minor calyces, this part, and the urocilium. Here also the urocilium. And the connective tissue under the urocilium or transitional epithelium. The collecting duct and the loop of Henle. The loop of Henle is very similar to the capillary. If we see the red blood cell on it, it means we have the capillary. Without red blood cell means we have the loop of Henle. These are most of them are the loop of Henle. Epithelium is very clear, darker than the other part. Then we have the muscular layer.
So repeat that.
You can see the muscular layer with two distinct layers, inner longitudinal, outer circular. All of these are circular, these are longitudinal, smooth muscle cell. And finally adventitia, outer part. So the wall of ureter has three layers.
Yes.
Adventitia, muscular
Muscular
layer, and
is-
the mucosa.
Mucosa.
About the type of epithelium.
Pseudostratified.
Epithelium in the ureter is the transitional epithelium. Transitional epithelium is a stratified epithelium. We have three types of cell: basal cell, these are basal cell, intermediate cell, and superficial cell or the umbrella cell. How we can recognize this epithelium is not a stratified cuboidal epithelium? Why we can call it transitional epithelium? Because of the
Umbrella cells. That and
it's the
binucleated.
only stratified epithelium. The nuclei in
Binucleated.
the superficial layer is larger than the basal layer. It's only stratified epithelium. And also, the umbrella cell, they are dome shaped, you can see, and some of them they have two nuclei. Only epithelium, the cell with two nuclei. But umbrella cell. So by this marker we can recognize it is the transitional epithelium. Then you can see the smooth muscle cell actually cut in the cross section. We have the cross section from them, so the nuclei are the round. It means we have the longitudinal cell. But in the circular, you can see we have the elongated nuclei. Means we have the circular. And finally, from here we have the adventitia. Muscle finished here. A smooth muscle cell finished here, and then we have the connective tissue around the ureter called adventitia. Okay, see. Urinary bladder is very similar to the ureter, but the muscular layer is very thick, and we have at least three layers: inner longitudinal, middle circular, and outer longitudinal. But the border is not distinct. It's actually we have an interwoven smooth muscle cell. So I start or begin again from the surface. You can see the epithelium, then lamina propria, and also in the wall we have the submucosa. This part is the submucosa, light area. Again, epithelium, lamina propria, submucosa, and the muscular layer. You can see we have a very thick muscular layer from here, beginnings, finish this part. Muscular layer, and this adventitia, we can say, adventitia in the outside, this part. Magnify. Again, the umbrella cell usually stains darker than the intermediate size. Umbrella cell, some of them has two nuclei.
Yes, sir. There's one.
Lamina propria. Then adventitia, sorry, the submucosa, the lamina propria, last epithelium called mucosa, mucosa, submucosa, and the muscular.
Muscularis.
Muscular layer, here you can see the smooth muscle cell cut or section longitudinally. We have elongated nuclei. But here we have a cross section from the smooth muscle cell because we have a round nuclei. Again here, longitudinal. Medial part, most of them are the longitudinal. This part we have the cross section or transverse section of the lymphocyte.
Aggregation of
In the
lymphocytes.
connective tissue, longitudinal, inner longitudinal, middle circular, inner longitudinal, middle circular, and again outer longitudinal. You can see again we have a round nucleus with two nuclei.